So my name is Johan Burisch. I'm a gastroenterologist from Copenhagen in Denmark, and I'm a professor at the University of Copenhagen. I am working with Faroese gastroenterologists in observing, describing, and understanding the high incidence of IBD in the Faroe Islands. So over the last 10-15 years, we have described the increasing incidence of IBD in the Faroe Islands. We have data going back to 1960, and we can see that there has been a steady incline in both the incidence and prevalence of IBD going up until very recent years. We have also described that the prevalence of IBD is more than 1% in the Faroese population, which is very high and is a level where other countries, such as Denmark, will only reach in 10-15 years, but they already have it here. We've also discovered that there are certain hotspots within the Faroese Islands where the disease is much more prevalent than in other regions. And these are some of the knowledges that we will use going forward within the miGut consortium, maybe addressing these specific hotspots, but also, of course, working by collecting samples in investigating what the underlying reasons for this increasing incidence and prevalence rate is. So we are really clueless at the moment why the incidence is so high. We are looking towards the diet, of course, which is one of the things that we are very much interested in, to understand how the diet influences the risk, how the microbiome of these patients is influenced by the diet, how some of the factors that are specific for the Faroe Islands, so the small population, those living maybe closer together for at least periods of their life, how this influences their disease risk. So that the miGut Health Consortium has this meeting here in the Faroe Islands is fantastic. It's an acknowledgement of the work that we've been doing all these years, trying to document that the incidence is high here and that there's a need for further research. I think it also gives us a boost in terms of getting publicity about this topic in the Faroese community, but also, again, reminding researchers across the world and within the consortium that there is a very unique population here that has a very high risk. The Faroese research community is growing and is improving, but is still in need of collaborations with centers of excellence across the world to further the research into the IBD origins and the reasons for the high incidence. So this consortium is a fantastic big step for us within the IBD research community in the Faroe Islands to move this forward. So we will start collecting samples, blood, stool, maybe even urine from individuals with IBD, hopefully also their relatives and also controls that have not developed IBD yet or will never have it, to see whether we can see any patterns, understand some of the mechanisms and differences between those that have the IBD and those who haven't. I think this is really an important initiative that we need to further our understanding of it. It has been something that we have dreamt of doing for many years, and now finally within this consortium we have the possibility to do this. And I really hope that we will gain some important knowledge to not only for the Faroese community, but also something we can expand to other populations, and that everybody can learn something from this. So the Faroese IBD cohort is very unique in both in terms of the high incidence, of course, but also because the Faroese population is quite unique compared to other populations. So that is already something that is important for, I think, the miGut consortium. This is a high-risk population that is difficult to find in other places, and which will hopefully give some answers to questions that we are asking within the consortium. And on the other hand, The research in IBD in the Faroe Islands cannot progress on its own. We are in need of collaborations with other centers that have expertise within mechanistic and translational research. So I think this is a win-win for everybody in this project. So of course we are still in progress of collecting samples and analyzing them. Hopefully we will get some insights into what is specific for Faroese in terms of IBD risk. Ideally this would tell us something about why the disease occurs, and maybe we can even do something to lower the risk, maybe even prevent the disease from developing. This is of course far thought and of course something that is far away in the future, but ideally that is the goal of it, trying to understand why this happens and what can we do about it.